Thank you for choosing to attend the INEAT Intranasal Naloxone Education and Assessment Training Program. The information you learn today can help save lives. What is an opioid? Prescription opioids can be prescribed by providers to treat moderate and severe pain. Opioids bind to pain receptors in the brain, blocking pain and slowing down breathing. Examples of opioids include heroin, morphine, oxycodone, methadone, fentanyl, hydrocodone, and codeine. These medications can have serious risks and side effects. An overdose occurs when a person takes too many opioids or combines opioids with other substances. Opioids may be combined with other substances without the user's knowledge. Overdose is acute poisoning, causing breathing to slow or stop. What is naloxone? Naloxone, also known as Narcan, is the only successful way to reverse an opioid overdose. Naloxone acts to bind to opioid receptors in the brain more powerfully than the opioids can, reversing the potentially fatal situation and improving breathing. Naloxone is not a dangerous medicine. However, proper training is required by law to administer the medication. This training that you're taking now provides that education. Anytime an overdose is suspected, 911 should be called. Stay with the individual until emergency medical services arrive. Naloxone results in the individual going into temporary withdrawal. However, naloxone effects only last 30 to 90 minutes. Opioids can stay in one person's system for hours. Multiple doses of naloxone may be needed. Therefore, it is critical to call 911 and get the individual additional medical attention. Some information about storage and handling. Naloxone is available as a nasal spray, known as intranasal, or an injectable intramuscular medication. This training focuses on the nasal spray. Naloxone can be given to any individual with a suspected overdose at any age, from infants to older adults. Keep naloxone in the box or storage container until ready for use. Protect from light and store at temperatures 59 to 77 degrees Fahrenheit, 15 to 25 degrees Celsius, room temperature. Naloxone can expire and its potency can wane over time. Naloxone is safe and effective. Naloxone will not harm someone if you give it to them and they are not overdosing on an opioid. Naloxone will not reverse overdoses from other drugs such as alcohol, benzodiazepines, cocaine, or amphetamines. In 2022, a total of 3,826 Tennesseans died of a drug overdose. 96% of these related to unintentional poisoning. That's approximately 10.5 deaths per day. Between 2018 and 2021, drug overdose deaths among Tennessee residents increased consistently. What to look for. Signs of an overdose may include unconsciousness or unable to wake up, slow or shallow breathing or difficulty breathing, such as choking sounds, or a gurgling snoring noise from a person who cannot be woken up, discolored skin, especially in nails or lips, and small, constricted, pinpoint pupils that do not react to light. What should you not do in an overdose situation? There are several myths about reversing an overdose. Do not put an individual in a cold shower or a bath. They could drown. Do not inject the individual with any other substances, such as salt water or speed. This does not work and could cause infection. Do not give the individual anything to eat or drink, or anything that could cause them to vomit. This could cause them to choke. Do not give any over-the-counter medications, such as vitamins or NoDoz. These do not help in overdose situations. What should you do during an overdose situation? Keep yourself safe. Stay calm and trust your training. If you see what looks like drugs around an individual, do not touch them. If you have rubber gloves and your overdose reversal kit, wear them before touching the individual. If you are exposed to a substance, the risk of toxicity due to skin contact with fentanyl is very low. Fentanyl exposure is unlikely due to your skin barrier. If a substance is inhaled or an accidental needle prick occurs, alert emergency medical services and be aware of overdose symptoms. So how do you administer naloxone? This demonstration will show you the important steps of lay, spray, and stay. To lay the individual down, make sure that you spray the device into either nostril and press the plunger firmly and stay with the individual until help arrives. Check that the scene is safe. Check the responsiveness of the individual. Call the person's name. Shake the person. Put on gloves in your naloxone reversal kit, if you have them. Lay the person flat on their back if not already in that position. Remove the naloxone spray from the box. Refer to the instructions on the box if you need them. Do not prime the device. There is only one spray for one dose in the dispenser. Make sure the person's head is tilted back and support the neck. Place the tip of the naloxone administrator within the person's nose. Press the plunger firmly to spray the dose. Remove the spray nozzle from the nostril. Note the time. If symptoms persist, an additional dose may be needed 2 to 3 minutes later. Call 911. Tell 911 the location, address, if breathing has slowed or stopped, any medications the person has taken if you know, and if naloxone was given and what approximate time it was given. Most cell phones allow the capacity to place the call on speakerphone. Step 2 and 3 are interchangeable. Follow the instructions from the 911 operator, including potentially initiating cardiopulmonary resuscitation or chest compressions. Stay with the person until medical services arrive. Place the person in the recovery position on their side. Use the person's hand to support their head. Bend the knee against the floor to prevent the person from potentially inhaling vomit. Stay with the person and try to comfort them as much as you can. Stay with the person until help arrives. Provide medical services with information including the last time that naloxone was provided, and if you know, tell them what substances the individual took and how much. Naloxone triggers opioid withdrawal symptoms. Try to comfort the patient, but also be aware that the patient may become aggressive. Encourage the person to receive medical services, to prevent another overdose, and to receive care from overdose symptoms. Discourage additional opioid use. Continued use will not help with withdrawal. If you are concerned about liability or police, there are 3 laws in Tennessee that protect individuals that respond or those that require naloxone. 1. There is a standing order in Tennessee that says anyone may obtain naloxone directly from a pharmacy without a provider prescription. 2. The Tennessee Addiction Treatment Act allows use of naloxone for someone experiencing an opioid overdose and provides immunity from prosecution under certain circumstances for the first overdose situation. 3. The Tennessee Good Samaritan Act allows any person to administer naloxone in good faith to a person experiencing an opioid overdose who has received basic training. A few reminders after administering naloxone. Remember, naloxone will only last in a person's system for 30 to 90 minutes. Opioids can stay in a person's system for hours. An additional dose of naloxone may be needed 2 to 3 minutes after the initial dose. A second opioid overdose can occur if a person takes additional opioids due to the withdrawal symptoms. It is very important to discourage additional opioid use. Some withdrawal symptoms the individual may experience include violent or irrational behavior, projectile vomiting, a cardiovascular event, particularly if the individual has a pre-existing condition, and they may experience body pain. You have completed the training for this course. Congratulations! Now you will take a short quiz to test your knowledge. Please click the link below to go to the quiz.